given where we are politically right now, what is the way forward on health care?
Well, the Democrats still have a strong majority in the Senate and in the House. A bill has already passed the Senate, and after a year of debate and discussion and passing of legislation, it would be a shame for the health care to just go back and start at square one. So I advocate, and many of the other groups working on health care are pushing for the House to pass the Senate bill, but only after they've been assured that there will be a fix using reconciliation. In other words, the Senate should be asked to change its own legislation so that it's more compatible with what the House has produced, which is a much more progressive bill.
What that means is that in the immediate term, a lot of people, particularly progressives in the House, are going to have to swallow a bill that has some provisions that, by your own admission, are not particularly good.
Well, the question is how much of a fix, how good of a fix can we get the Senate to agree to in terms of things like a national versus state exchanges that are in the Senate bill, in terms of better funding for affordability for low-income people and middle-class people. In terms of, some people are even talking about putting the public option back in as part of that fix. The question is, how good an agreement can the House get, and can we get from the Senate for improving the bill? It seems like we ought to be at least to get it as good as what the House and Senate negotiators had already gotten just prior to the Massachusetts election.
And of course, through the reconciliation process, all you need is 51 votes.
That's right, and the Senate bill has already passed the Senate. If the House passes it, after being assured that they will get the reconciliation for the improvements in the bill, then we could, in a month or two, have a real health care bill signed and signed by the President. It won't be the best of all bills. It won't be as good as a lot of us wanted. But the reforms that are in that legislation, that combined legislation, are worth doing and creates a baseline for improving health care over time.
Now, one of the things that you're doing to keep this health care issue alive and high profile is that you're going to be at a demonstration on Tuesday. And tell me about that demonstration.
It's sponsored by Healthcare for Americans Now and MoveOn.org and all of the groups that are in HCAN. We're going to have a demonstration at noon on Tuesday at the Chamber of Commerce building over across from the White House. So this coincides with demonstrations and events that MoveOn and HCAN are doing all over the country. The basic message is, don't let the corporate interests hijack and prevent healthcare from passing. Don't let the corporate interests who can now spend their own money on massive amounts of money on politics, don't let them buy our political system. We expect that there will be lots of people who desperately need health care showcased at those demonstrations, and we're sending a signal not only to corporate America, symbolized by the Chamber of Commerce, but also to the House and the Senate and to the White House to not delay but to go forward on passing health reform.
Well, people power can still get this thing done, so that's good to hear. Thank you very much.
Yeah, good. Thanks.